Jessa Chabeau received her BA in Sociology from Penn State U and her Master's in Social Work from University of Pittsburgh. For her Master's, she focused on community organizing and social admin. While studying at Pittsburgh, Ms. Chabeau participated in a 9-month field placement at Southwest Pennsylvania Environmental Health Project, EHP, in 2013, inspiring her to officially join them in 2014 after graduation. The Southwest Penn EHP collects symptom data from communities living near shale gas development. Jessa will discuss health impacts through our own health data and stories from the residents themselves. Then she will present EHP's Environmental Health Medical Toolkit to help healthcare providers in frontline communities. Jessa leads EHP's efforts to better understand the mental health impacts of fracking on individuals and their communities. If you have a question during her presentation, use the Q&A button and mention Jessa. And now, Jessa Chabeau.
My name is Jessa Chabeau, and I am the Regional Manager for the Appalachian region for the Southwest Pennsylvania Environmental Health Project, commonly referred to as EHP. In 2012, EHP opened its office in Washington County, Pennsylvania, the most heavily fracked county in the state, to work with residents in the region who were impacted by oil and gas. EHP's mission is to defend public health in the face of oil and gas development. We provide frontline communities with timely monitoring, interpretation, and guidance. We engage diverse stakeholders, health professionals, researchers, community organizers, public servants, and others, because knowledge protects health. As mentioned during my presentation, I will be discussing how this industry impacts your patients, the health impacts as we understand them through our own health data, and through stories from residents themselves. Then I will present on our medical toolbox, a collection of resources and information on this topic that you can use to help your patients on the front lines. But before we begin, I want to discuss why you as a healthcare provider should be alarmed by this industry. First, you should be alarmed by this industry because there is a blatant disregard of the precautionary principle. The principle implies that there is a social responsibility to protect the public from exposure to harm when scientific investigation has found a plausible risk, but that is not what is happening. Next, there is also a lack of response by government and industry as public health implications continue to grow. And lastly, the abundance of loopholes in environmental regulation regarding emissions and waste is inexcusable. So let's hear from residents here in Washington County about how the disregard for the precautionary principle and loopholes have impacted their daily lives.
I worked in the coal industry for 41 years. I worked underground. I worked in an environment that wasn't very pleasant. I breathed the coal dust. I worry about black lung, which supposedly I have a touch of it. Something I have to watch out for the rest of my life, and I surely don't want to be breathing any type of emissions from the gas and oil pads that we've been enduring in the last few years since it's been put in production.
It was real quiet until the industry moved in, and I don't know, it rocked us, 50, 60 trucks a day up and down the road, using it as a haul road that once was just a red dog road that you would see one or two neighbors max for the day.
I've lived basically on this property in this area for over 50 years. And until this plant and compressor stations were put back there, it was a nice quiet area to live.
My brother-in-law lived right in that house down there. Never smoked, never drank. 3 years ago he died of lung cancer and liver cancer. Now, in November, I was diagnosed with throat cancer.
They've had Geiger counters on these trucks coming in with anywhere from 2,500 to 8,200 becquerels of radiation that they're dumping in just regular dumps. The used brine water, the used fracking fluids all mixed in with it. Anything else they're pulling out of the earth, plutonium, lead, radiation, plus the silica dust from them drillings in the air and everything.
People up the road, a couple people up the road are sick from the Twilight compressor station. Yeah, my friend that lives on the next road, up on the next road, Woodland Road, parallels that, he's sick as hell. But everybody up on that hill's sick.
We had an incident, I think, in the county adjoining us back in like 2015, where a wellhead was ignited, and first responders were not able to get within 750 feet of that wellhead burning. And my house is only 550 feet away. I'd say it would not be a very good thing. It's just stuff that needs to be considered, and it's not being considered.
I've had spills on the road, and they came by at night, you know, with water trucks and big road brooms, and brushed it and hosed it onto people's land.
We know that current protocols for assessing air standards do not account for the fact that air is released in spurts or episodes, not at a redo that, sorry. We know that current protocols for assessing air standards do not account for the fact that air is released in spurts and episodes, not at a constant rate. So the intensity, frequency, and duration of actual human exposure to toxic pollutants is unknown. These peak exposures can produce acute health impacts, which are not being accounted for. Also, mixtures of different compounds can have greater effects. These mixtures may contain potentially toxic substances like nitrogen oxide, volatile organic compounds, polycyclic aromatic hydrocarbons, particulate matter, and hazardous air pollutions. And lastly, these protocols do not account for local weather conditions, which are shown to be a strong determinant of exposure. When assessing health risks, 24 averages are utilized. Currently, there are no appropriate standards for assessing repeated, severe, short-duration exposures, which can produce acute health impacts. Volatile organic compounds are often measured in VOCs are often measured in 24-hour grab samples too. These episodic air emissions might mean that people may also experience episodic symptoms. We know that vulnerable populations will be more at risk. This includes fetuses, children that are growing and developing, people with compromised immune systems, and the elderly.
My name's Brian Lakanich. I reside in Deemston, Pennsylvania, Washington County. I've had fracking on my land since 2011. When they first came in, they offered me $8 to $13 million. I thought I hit the lottery. I was a cheerleader for them until 2012, when I put my son into the bathtub and he came out with bleeding sores seeping on his body. In contacting the DEP, they replaced our water. My farm has been totally destroyed and left in a shambles, and nothing is done about it. The house has been fractured and the foundation is falling in. My water is undrinkable. My son has been diagnosed with asthma, headaches, and he has uncontrollable bowel movements. Myself, I got the headaches, asthma as of 2 years ago, neuropathy last year, and I've been repeatedly hospitalized for different things that have happened to me from consuming my water, up to and including kidney failure.
Here in Pennsylvania, the Department of Environmental Protection, commonly referred to as the DEP, determined that over 350 private water wells were impacted by oil and gas activities. However, the number of drinking water related complaints was over 4,000. This means that 96% of cases were dismissed by the DEP, leading many to believe that impacts to private drinking water wells is a much more widespread problem than has been publicly acknowledged. So why is this a big deal? The chemical mixture injected into unconventional wells not only includes known toxic compounds, such as formaldehyde and ethylene glycol, but also hundreds of secret proprietary chemicals. This fracturing fluid is not only present during the initial injection process, but a substantial amount returns to the surface along with the oil and gas. 2 Yale studies evaluated hundreds of chemicals used in fracking fluid, and while the majority had not been evaluated for human toxicity, over 150 demonstrated reproductive or developmental harm, and over 30 were known or potential carcinogens. Unfortunately, industry is exempt from the hazardous waste laws since 1988, so there is no cradle-to-grave tracking system, leaving millions living around this industry in danger. Over the past 8 years, EHP has collected information from several hundred people and learned a great deal about health symptoms that people experience. EHP health professionals and scientists have developed a standardized questionnaire to assess individual health and exposure to environmental hazards. EHP looked at 88 residents who came to us and lived within 1 kilometer, which is about a half a mile, of wells or compressors. In our most exposed clients, the top reported symptoms include difficulty sleeping, stress, headache, sore throat, itching and burning eyes, shortness of breath, anxiety, fatigue, sinus pain, cough, numbness, and tingling. We know that many of these symptoms are common. However, we're interested in the fact that not all of them are common and that residents themselves attribute many of their symptoms to the well pads or compressor stations nearby their homes. We also see similar patterns of symptoms as other researchers. Here is a handout we created on health outcomes associated with exposure to oil and gas development from peer-reviewed epidemiological literature. The research includes negative birth impacts, hospitalizations, asthma exacerbations, certain cancers, as well as reported symptoms like migraine, fatigue, and rashes. So what can you do as a healthcare provider? You as a healthcare provider can support your patients who are living and working near oil and gas development by integrating a few simple steps. Ask patients about potential environmental or occupational exposures. Consider environmental exposures when formulating a differential diagnosis. Look for increases in occurrence or severity of recognized illnesses rather than new diseases. Familiarize yourself with resources to consult. Be ready to recognize variations in response to exposures, particularly in vulnerable populations such as the elderly or children. And last, add environmental exposure questions to patient intake questionnaires. Over the past several years, we have been working to educate healthcare providers and have put together a medical toolbox on this topic. The first thing in our medical toolbox is the Environmental Health Medical Toolkit. This toolkit contains educational materials and forms for healthcare providers. The second part of our toolbox is reference materials for healthcare providers, such as guidance from the Center for Disease Control, an agency for toxic substance and disease registry, on the interpretation and blood laboratory analysis of VOCs, information from the Occupational Safety and Health Administration and the National Institute for Occupational Safety and Health about workers related to silica dust, and a repository for oil and gas energy research. Also, the toolbox includes community health education materials, such as health outcomes from peer-reviewed epidemiological literature, research on mental health in communities with oil and gas development, and handouts on oil and gas development related to asthma and cancer. First up in the medical toolbox is the Environmental Health Medical Toolkit. The goal of this toolkit is to get more healthcare providers to inquire about environmental and occupational exposure. The toolkit contains examples of screening tools and questions to ask patients related to environmental exposures. Proposed case definitions for confirmed, probable, and suspected health effects related to oil and gas exposure. And last, recommendations for diagnostic coding. First in the Medical Toolkit are examples of patient screenings, including the Survey for Patients' Potential Exposure and the Exposure History Form created by the Agency for Toxic Substance and Disease Registry. One way to introduce these measures is to ask your patients a few simple questions. Do you or anyone in your family live, work, or attend school in proximity to industrial plant, dump site, or drilling site? Have you experienced any changes in the water quality, such as color, taste, or smell? Are you currently exposed to metals, dust or fibers, chemicals, fumes, loud noises, or vibrations? Have you ever changed your residence because of a health problem? And last, do you or anyone in your family work in the oil and gas industry? Next up in the toolkit is the potential health effects due to inhalation chart, which is a quick reference guide to over a dozen chemicals associated with oil and gas development, their sources, along with the short and long-term health effects. This chart was created from health information primarily derived from the Environmental Protection Agency and the Agency for Toxic Substance and Disease Registry. Next in the toolkit are the case definitions. 3 case definitions can be found within the Medical Toolkit. For a confirmed case, documented laboratory confirmation of environmental exposure through water contamination or air contamination must be combined with clinical signs or symptoms. These clinical signs could be respiratory, dermal, or neurological signs, like headaches and dizziness. Signs and symptoms should begin or worsen after oil and gas activity has begun and must not be easily explained by a pre-existing medical condition. A probable case presents as the verifiable presence of environmental exposure to facilities extracting, transporting, processing, or storing oil and gas or waste within 1 kilometer of the patient, and again, must be combined with at least 1 clinical sign or symptom. And finally, a suspected case includes environmental exposure to facilities within 2 kilometers and 1 or more clinical signs or symptoms. These case definitions should not be used as the only criteria for determining exposures related to health effects. It is just one more tool in your toolbox. The last tool in the Medical Toolkit is the Diagnostic Coding Sheet. Based on research and patient self-reported responses to potential exposures to oil and gas activity, there are ICD-10 diagnostic codes that may be warranted. EHP has compiled the following coding guidelines to assist you in diagnosing and billing the possible exposures to oil and gas activities. The following codes are based on assessments seen in our office and are not all-inclusive. It is also important to become acquainted with the latest research. Various epidemiological studies have found statistically significant associations between exposure to oil and gas and adverse health outcomes. Some examples include negative birth impacts, asthma exacerbation, as well as symptoms like migraine, fatigue, and rashes. However, many more health outcomes are plausible based on the known health impacts of exposure to various chemicals emitted by the process. To further explore the literature on this topic, please go to the Research and Fact Sheet section under the Healthcare Providers tab of our website. There you will find more information along with the handout I mentioned earlier on health outcomes associated with exposures to oil and gas development from peer-reviewed epidemiological literature. All of this information discussed today can be found on our website under the Healthcare Providers tab. You can also find additional information such as biomonitoring information, our healthcare provider quarterly newsletter, healthcare provider forums we've hosted in the past, and how you can get involved and advocate on behalf of your clients. As a thank you for your interest in this medical toolkit, EHP has partnered with the University of Pittsburgh School of Medicine to provide you with the opportunity to earn 1 CME credit by answering a few questions about the content you just heard. To redeem this credit, please click on the CME CEU button under the Healthcare Providers tab. If you're interested in a hard copy of the Medical Toolkit or have questions, please contact us by phone at 724-260-5504 or by email at info@environmentalhealthproject.org. Thank you.